sarvangasana, shavasana, and some of the breathing practices like kapalbhati, nadi shuddhi, and ending with some mindfulness meditation. I'll also show the demonstration of how this can be done. So this is step number 1 of Surya Namaskara. You have to stand straight, join both of your hands like a Namaskara position, and then with inhalation, slowly lift your hands upwards and bend your lower back. This is step number 2. You have to stand straight, bend forward from your lower back, and try to touch both of your hands to the ground. And also try to touch your forehead to the knee. This is step number 3. In this, you have to fold one of your legs, like in this case, fold your right leg and keep it on the ground. This is also called asana. Next step is Shashankasana. This is Ashtanga Namaskara. In this, all of your limbs will be on the ground except your abdomen and hip region. So your chest will be on the ground, knees on the ground, only your abdomen in the air. Next step is in the step 6 also it is included. This is Bhujangasana. To lie down on the ground and lift your chest slowly upwards. This asana is called Parvatasana. Again, Shashankasana. Ashwasanchalanasana. Padahastasana. Uttisthastasana. So this is Trikonasana. In this, first stand straight, lift your hands to the shoulder level, and try to touch your right leg with your right hand, and then on the opposite side, left leg with your left hand. You can hold the final position. So this is the final position. You can hold for 30 seconds and then come back to normal position. Next pose. This is called gati chakrasana. So to stand straight, lift your hand to your shoulder level and then touch your biceps. then twist to your opposite side. So you can hold the final posture for 30 seconds and then relax. The same thing you can do on the opposite side. You can lift your left hand and twist to your right side. Next asana is vakrasana. You have to sit on the mat, hold your right leg, twist your right side, and hold the right ankle with your left hand. The same thing you can repeat on the opposite side. When this also we can hold the final posture for 30 seconds and then release. Next is sarvangasana. Lying down position, lift your both the legs and with the support of your hands, lift it further up and hold the final posture and slowly release the posture. So after all these asana practices, it's a must and should that you have to give relaxation to all the parts of your body by doing shavasana. So in this, you lie down straight on the ground, keep your legs apart, hands apart, and you have to practice something called deep relaxation technique. So in that, you'll be relaxing your body parts part by part, starting from your toes. First, relax your toes, your ankle region, then your calf muscles, then your thighs, your abdomen region, chest region, neck, hands, face, forehead. So like this, you have to relax each part slowly and practice this for 10-15 minutes. Practice deep breathing. Take deep air in, exhale slowly, completely. Then we'll see some of the pranayama practices. So this is called Kapalbhati practice. So this can be practiced either on Vajrasana or Sukhasana. In Vajrasana, if you're able to practice, you can do that, or else you can do it in Sukhasana. In this practice, first you have to take a deep breath in, and then for next 60 seconds or 1 minute, you're only going to exhale. You're not going to inhale, you're only going to exhale. So when you exhale, your abdomen should shrink in. So beginners can do 30 times in a minute or 60 times in a minute. So as and when you're acquainted with the practice, you can go for 90 strokes in a minute or 120 strokes in a minute. People who have abdominal hernia should avoid this practice. And people who have high blood pressure should also avoid this practice. Any other cardiac issues, you can do it under the guidance of an expert. So 60 strokes in a minute, you can practice up to 2 to 3 minutes. Next practice is called Nadi Shuddhi. So in this, same thing, like either you can sit in Vajrasana or Sukhasana. You have to fold your right finger and middle finger and keep it near the root of your thumb. You can use your thumb to close your right nostril and the other two fingers to close your left nostril. So in this practice, first you have to inhale through left, close your right nostril with your thumb and inhale through your left nostril, close your left nostril, hold the breath for 5 seconds. Now slowly exhale through the right nostril. After exhalation, close the right nostril. You have to hold the empty breath for 5 seconds. And then now inhale through right nostril, open the right nostril, keep the left nostril closed. Inhale through right nostril, hold the breath for 5 seconds, and exhale through left nostril and hold the empty breath. So this completes one round of Nadi Shuddhi Pranayama. So like this, you can do 9 rounds 2 times in a day. These are the set of practices. So all these practices we can do 2 times in a day, morning and evening. So it should be practiced either in empty stomach or 3 hours after your last meal. And after all these practices, there's something called mindfulness meditation. So either you can practice Padmasana or Vajrasana. If that's not possible, you can sit in any simple posture and keep your spine straight, keep your eyes closed. And now start with observing your breathing pattern. Don't change your breathing pattern. Just keep observing your breathing pattern. And after each inhalation and exhalation, there is a gap. So for beginners, that gap you might not be able to observe since it's a very small gap. There are thoughts running around. So if you keep practicing it, you'll notice that the gap is getting bigger, wider. So you'll be slowly able to observe your thoughts and creating more and more silence in your mind. Over time, practice of this meditation has been found very beneficial in managing stress and some disorders related to stress, like PCOS, diabetes, hypertension, obesity, and some of the psychosomatic diseases. All these practices are definitely going to help in managing PCOS if practiced in a right way and regularly. That ends our demonstration. Thank you.